Hello, everybody. Thank you so much for being here. And thank you for attending the American Red Cross Los Angeles Community Conversation, supporting families during COVID-19. The time is 1:01, so we should be good to go. All right, thank you again for being here. I'm Kendall Dunlop-Korsness. I'm the faith-based senior specialist at Red Cross LA. Again, this is the community conversation supporting families during COVID-19. I hope you all are doing well, staying safe, and finding joy, community, and reflection during these historic times. Now more than ever, families need the support of our community and faith leaders to thrive during this time of pandemic and uprising. It is a historic moment, and we want to thank you so much for serving your communities, your families that you serve, and for taking time out of your Wednesday to join us for this event. I think it'll be a very special event. We'll hear from 4 wonderful panelists that have a lot to offer. We'll have time for questions at the end of the panel. So you can enter them in the chat as we go, and we will make sure those get addressed at the end. So now I'm going to introduce our panelists, and we're very grateful for their time today, and we have a lot of excellent resources to offer. So first, we will have Nancy G. Harris, the Executive Director of Faith Foster Families Network, 3FN. A Los Angeles native, Nancy Harris currently serves as the Executive Director of the Faith Foster Family Network, 3FN. 3FN is a faith-based collaborative of 6 churches and faith-based organizations. They have formed this network to support foster families, foster youth, and those impacted by the foster care system in South Los Angeles. It is one of the first projects in the area to bring together the faith community, philanthropy, and the public sector to collectively address a system in need of support. Prior to 3FN, Nancy served as the Executive Director of the Holman Community Development Corps, which focuses on youth workforce development and has provided employment to over 300, as well as providing job readiness, leadership, and personal development training to an additional 500 inner-city youth ages 14 to 24. Prior to Holman CDC, her love of community and helping underserved populations was demonstrated in a 22-year career as a mortgage and real estate professional. She and her firm assisted more than 1,000 individuals and families to realize the dream of home ownership. Nancy also currently serves as an arbitrator for FINRA and as a Los Angeles County Commissioner for the Quality and Productivity Commission, appointed by Supervisor Mark Ridley Thomas. She's a licensed California real estate broker and is a proud alumna of AABLI Class Number 5. Nancy will be speaking on the effects COVID-19 has had on her work at 3FN on foster families in the foster and adoption system, and we're very excited to have her speak today. Second, we will have Mikey Latner, Executive Director and founder of Project Camp. During some of the most tragic, disorienting moments in people's lives, such as natural disasters, there is often one group of people left in the dark: children. Relief often comes in the form of basics: food, shelter, and clothes. What about joy, fun, and community? Project Camp adds to relief efforts to nurture and care for young people during what could be one of the most traumatic events in their lives. Project Camp helps young people and families cope with challenging events. Our goal is to train and support communities to create spaces for kids to process the extreme events around them and to support them through those experiences. Founder and Executive Director Mikey Latner comes to this work with decades of summer camp experience and leadership. He has moved into a variety of different experience-based education venues as a camp director, rock climbing instructor, outdoor facilitator, and youth programs consultant, led by the belief that creating space for youth to be their whole selves allows them to explore and make their mark on their communities. Mikey will be speaking on the effects COVID-19 has had on Project Camp and summer camp and families. We're very excited to have Mikey, and we're very excited to have our third speaker, Dr. Debra Duardo, the Los Angeles County Superintendent of Schools. Dr. Debra Duardo was appointed Los Angeles County Superintendent of Schools by the Los Angeles County Board of Supervisors, effective May 15, 2016, designating her as the top education leader of the nation's most populous and diverse county. In this post, Dr. Duardo provides leadership and support to the superintendents and other top administrators of the county's 80 K-12 school districts. She has more than 30 years of professional experience working with at-promise students and their families. Her unique life experience as a high school dropout able to overcome her obstacles and rise to the position of county superintendent, drives her passion to ensure that all students receive an education in a safe, caring environment, and that every student is college prepared and career ready. She holds a master's degree in social work from the University of California, Los Angeles, and a doctorate from UCLA's Graduate School of Education and Information Studies. Dr. Duardo will be talking about how COVID-19 has affected LA County schools and students. We're very honored to have her speak today. And then last but definitely not least, we'll have Myra Valle, the American Red Cross Service to the Armed Forces and International Services Director for the Los Angeles region of the American Red Cross, speak. Myra Valle started her military journey as a volunteer for her sister's unit in 2007 for the National Guard. She then was hired as the Family Programs Coordinator of the California National Guard Operation Ready Families Program, where she served for 3 years. During her time with the National Guard, she was part of the Yellow Ribbon Program, which prepared, educated, and supported service members and their loved ones during a deployment. She then worked for the employer supporter of the Guard and Reserve and managed over 130 volunteers that supported the community and events by educating the community, military, and loved ones on their civilian employer rights. In 2015, she joined the Army Reserve Family Programs team in West LA and supported military units and their loved ones in over 40 units, with an average of 150 to 200 service members per unit on resources and education and the entitlements they're qualified for. She raised awareness on the needs of the military and their families by attending community and military events. Within months, she became part of the training team for the Army Reserve, where she traveled throughout the U.S., educating military command, staff, volunteer, and loved ones of the Army Reserve Family Programs and regulations. She helped write curriculum, workbooks, and presentations that reflected the changes occurring in the military. After traveling to over 15 states for 3 years, she founded an organization close to home, the American Red Cross. Myra has been a part of the American Red Cross for 2 years and is serving as the Services to the Armed Forces and International Services Director in Los Angeles for 6 months now. We are so grateful to have all of our panelists here and such a diverse array of resources and experience. And we're excited to learn more about how we can support our families during COVID-19. So we'll dive right in, and we'll start with Ms. Nancy Harris, Executive Director of Faith Foster Families.
Thank you very much. I hope everybody can hear me. Thank you for this opportunity. I want to definitely lift up and extend thanks to the American Red Cross Los Angeles region team for putting this together. This is a very important conversation to continue to hear about the resources that are available to our families at this continuing to be tough times in our lives. So I am grateful for the opportunity to share with you today. I am the Executive Director, as we heard, of the Faith Foster Families Network, and our mission is to sustain a faith collaborative that provides resources, safety, and well-being to those children and families impacted by the child welfare system. We do our work in 4 areas. We do it in terms of awareness raising and education, human support, tangible resource distribution, and recruitment of new families, new foster families, and kin caregivers. It has been a daunting task. As putting together and sustaining this faith collaborative during this time, and one important thing I wanted to mention is who are the members in our faith collaborative. And we are focused in SPA 6 South LA. That's where we primarily are focused in our work. Our members include the Biddy Mason Charitable Foundation, which is an outreach ministry of fame, First AME Church in Los Angeles, Crossroads United Methodist Church in Compton, Center of Hope, LA, which is actually in Inglewood, Holman Community Development Corporation, West Angeles Community Development Corporation, and as an affiliate member, we also have the City of Refuge in Gardena. So we have come together as a collaborative in the faith community in this particular area to provide supports to resource families and vulnerable families, primarily in SPA 6. SPA 6 has been, and for those of you who don't know the term SPA, that is Service Planning Area of the county. And in SPA 6, Service Planning Area 6, it has had a disproportionate number, a large number of kids being removed from homes. A lot of our children in the child welfare system are children of color. In fact, over 60% of the children in care in our child welfare system are of color. So it was pressing upon us as a faith community to lock arms and come together as a group so that we can address this issue on a much bigger scale. Individual churches have been doing their part for child welfare for quite some time, but as a collective group, we felt we could address many of the issues and provide supports in a much larger capacity. So fast forward to the COVID environment, which has changed the game on many, many levels. The differences between the haves and the have-nots have been even more highlighted during this time. And the disease has disproportionately impacted people of color. One of the things that we actually were surprised about, but then immediately got into gear, was the fact that our families needed resources. And when I say resources, our families were in desperate need of food, basic things, food and basic resources to carry on their lives. When COVID and the Safer at Home Act went into play, we had to, it was all of a sudden, it was abrupt and all of a sudden, and everyone had to make adjustments very quickly. Not all of our families are prepared to make those adjustments and weren't able to make those adjustments as quick as possible. So for instance, let me share with you, if you've got a family, foster family or vulnerable family that has 3+ kids, let's say. Well, during the Safer at Home Act, and even now, you know, it's challenging to take your family to the grocery store. You know, that was a challenging time. And, you know, if you've got little kids, especially, it's challenging taking small kids to the grocery store, even on a good day. But just imagine in this environment, just imagine if maybe transportation is an issue for you. So just basic things like getting to the grocery store, getting diapers for your babies, childcare, just in general, has been challenging for our families. So we had to step up as the Faith Foster Family Network and really step in to provide those tangible resources for our families. Early on, we rallied our churches, our members in 3FN together to do small things, do small food basket giveaways here and there. And then ultimately, in the month of May, which was actually also National Foster Care Month, we came together in a bigger partnership with Supervisor Ridley Thomas and 6 or 7, the Department of Children and Family Services and 5 other agencies, to put on 4 events at 4 of our 3FN locations to distribute food and all sorts of tangible resources. We were blessed to get donations from milk donations, all toothpaste, all sorts of different donations that we were able to help in total close to 600 families of resource and foster families, as well as vulnerable families, with that type of thing. And as I sit today, we still continually get calls for tangible resources. So that is probably the biggest area that we have been able to support and continue to give much needed supports in those particular areas. The other area of that, and of course this dovetails into so many other things. We're going to hear more about education and schooling, because our families everybody has been compromised with having their children at home while they're trying to work, as well as trying to educate the kids while at home. A lot of our families that are the digital divide, let me start by saying that. The digital divide is also real. Not everyone and not every family has got good internet capabilities. So the schooling of the children, again, is a challenge also too. And of course, the stress level on the caregivers is a big thing also. Childcare. The other thing that is challenging in terms of resources and helping some of our families is especially for our immigrant families also too, many of whom were not able to obtain support through the CARES Act. And so resources, tangible resources for that population has been a big issue also. In addition, the other thing that we're seeing specifically in the child welfare space, especially in the beginning, was the continuation of family visits, which are called visitations. So many families are court ordered to, in order to reunify with their families, to have visitations. And so normally the visitations have been done face-to-face, done at neutral locations, all different kinds of locations, including churches, including some of our 3FN member churches. And so with the onset of COVID and the social distancing, the visitation issue, especially in the beginning, was a challenge. And so the department was creative in many ways with at least trying to implement virtual visitations. And of course, you know how, it's sometimes challenging if you're with a 2-year-old trying to have a virtual visit, but there were, that was the alternative, especially in the beginning. So the visitation for a while was a challenge, which means that biological families, it was not easy for them to try to have their visitations and their reunification meetings because of that lack of face-to-face touch. That has gotten better over the time, and the department has gotten very skilled at providing the proper COVID regulations and specifications so that the face-to-face visits could continue. So we are seeing more, it has picked up considerably in the last month, 45 days, where the face-to-face visits have picked up, because that was something, again, as I said, it was concerning not only to the biological families, but also concerning to the foster and resource families that weren't able to facilitate these visits. So those are two critical areas that we have seen there is huge need, and that's where we've been able to step into support. With the visitation, 3 of our locations in 3FN, Crossroads United Methodist Church in Compton, the Center of Hope in Inglewood, and West Angeles CDC and West Angeles Church each have visitation sites. And so we've been working closely with the department to make sure that we can help those families in reunification. The other thing that we're doing for families, and this is primarily for the resource/foster families, and actually we're doing it this evening, and that is having our resource family caregiver check-ins. And so twice a month, we host a virtual caregiver check-in where families, parents primarily, can network with one another and commune with each other for support, to exchange ideas, exchange information on some techniques and tactics that are working, share additional resources that the groups may have or individuals may have that they can share with the group as a whole. And that's proven to be very beneficial for our families. Our caregivers really appreciate that time where they can decompress and be able to connect with people of like minds and like experiences, so that they can share. And it's a time also to check in with them as human beings, and to really talk about the stressors that are out there, and that we as 3FN and other professionals can step in and to provide some solutions to some of those issues. The human connection is a huge thing, and we all have been challenged with continuing that human connection. When you have families, especially impacted by the child welfare system, that may even have medically fragile youngsters or youngsters with special needs, they're not necessarily able to go to their schools or their daycare places during the day. So it provides additional stress on our caregivers and the family as a whole. So it's big. It's a big thing to tackle, but I have to say that being connected in a forum like this also too is very necessary and needed, because no one then feels as if they're out there all alone and can't get what they need in terms of support. So please visit our website. I think I just saw it go up on the screen. You can visit us at faithfosterfamilies.org. And reach out to us if you need support or know some families that do need assistance. So am I good? Do I have some more time or what?
That was wonderful. Thank you,
Okay.
Nancy. Yeah, and if anyone has any questions for Nancy, you can put them in the chat or use the Q&A function, and we'll answer them at the end. And as she said, her website and Instagram and Facebook are in the chat. All right. So next we will hear from, again, thank you, Nancy. That was wonderful insight, really wonderful resources you have at 3FN. Thank you so much. Next we'll have Mikey Latner, Executive Director and founder of Project Camp, and he'll speak on the effect COVID-19 has had on summer camps and resources moving forward.
Hey everyone, good afternoon. Thank you for being here today, and thank you for creating this space. Thank you to Kendall and to John and Jennifer and the Red Cross team for putting all these resources together. I just want to echo what Nancy was saying about the space to be able to bring minds together and collaborate, I think is, for the work that we do, essential, and I think the work that we're all doing, very essential, and becoming much more the top of our priority list in this time. I want to talk a little bit about what Project Camp has been doing and how it shifted in some ways, and in some ways just became more relevant as COVID really expanded into our day-to-day life. Originally, Project Camp was set up to run pop-up trauma-informed day camps after disaster. So I actually started in 2017 with a community of summer camps and faith leaders in Houston responding to Hurricane Harvey down there. The essential need came from the community saying, schools are closed after the hurricane. Families need a place for kids to go, which I think very much echoes the time that we're in right now. And so as a camp professional, as working in an organization with other camp professionals, our solution was to spring up childcare. And I think the thing that I take most from that experience generally is that, and what I like to tell people is like, I'm not a firefighter, I'm a camp director. So you don't send me to go fight the fire, but as a member of a community with a skill set, there's a way to marshal all of those skill sets and those resources. And that's really the basis of where Project Camp came from, originally to provide pop-up childcare and to marshal the skill sets of childcare providers, teens with day camp experience, overnight camp experience, babysitting experience, to help build up resources to support communities. We know that in this time, all of us have been particularly vulnerable to the protracted nature of COVID and the physical and mental and emotional toll that takes on all of us. Children are uniquely vulnerable and are particularly vulnerable in this space as well. There was actually in 2011 the ACE study put together by the CDC and Kaiser Permanente that measured ACE is adverse childhood experiences. It measured the effect of acute adverse childhood experiences, such as facing a disaster, a trauma at home, a trauma out in the world for kids, and the long-term effects of that experience. And what it found was that there really is a deep, lifelong, and in many ways generational exposure to toxic stress that comes from adverse childhood experiences that are not addressed early on. What the CDC, what the ACE study also found was that activating resilience factors early, intervening with children early in the immediately acute, what we call the acute post-acute time right after a disaster or traumatic event, helps stave off the long-term effects of that toxic stress, literally mitigates the effects of post-traumatic stress. And those resilience factors are actually, for members of the faith community, as educators, these are things that you actually already do in some way, shape, or form, and that you do intentionally, and you may not, and you may like only understand that what the different components of how you're activating them and how that can be furthered to accomplish these goals. Really, the resilience factors that you're activating with people, with children, are creating a sense of agency, creating safe, supportive relationships, and establishing real connection. I think we've seen as community members, the pop-up mutual aid that's connected us, the return to like neighbor support, the reaching out that's happened to, people talk a lot about like reconnecting with old friends on Zoom, but also just being able to like find spaces to be able to grab that human connection in many ways a much more intentional way than we had in the past. And that creating that all creates a real sense of agency. When I say sense of agency, I mean, use the example of like a car accident. If you're involved in a car accident, there is a difference in the amount of trauma that you're exposed to by being able to know the accident's coming and put your arms up. And so studies have shown that those people who are able to make some sort of reaction to an incident like that are much less likely to leave with traumatic exposure, with toxic stress, than those who are blindsided. And this all come to fruition in childcare space, in the camp space, because the things that we do to provide support and structure for our kids, anything that we provide, actually has a meaningful impact on their ability to weather this period, our ability to weather this period, and the resilience that we can foster in kids. So Project Camp, I said, originally was looking to set up pop-up childcare in April, May, to support frontline workers, essential workers, people who are going back to work at warehouses and in the healthcare industry and at grocery stores, knowing that we were trying to create a space to be able to allow parents to get back to work and create meaningful space for kids. The goal of all of that was really to just create the space. We've since integrated a lot more understanding of trauma-informed care, and it's a lot of what we do now with schools and with other youth-facing organizations, but at its root, what we are really doing is creating space for kids to be kids. And I think that's the thing that we take and we really return to every time this period has like thrown society a curveball. That's the actual essential function that we're trying to accomplish, and that's the thing that our children and our communities need. There's a lot of resources from LA County Public Health actually on reopening for day camps that we've gotten a lot of information from, and I actually think is really helpful for anyone working with youth and in community spaces. They actually posted a set of really essentially 4 factors to be able to open up day camps. One was maintaining small groups of no more than 10 that were contiguous throughout the day. So 10 kids in our measurements, like we use 1 to 2 staff members, and that's the same group that's together throughout its time at camp. LA County Public Health also asked that there be no overlap of no shared spaces and no shared equipment. And that those were the essential functions of being able to mitigate as best as possible the spread of COVID-19, and to be able to create the space for meaningful, safe, supportive connection in a day camp setting. I think that was really helpful that LA County Public Health put that frame of mind out there to the camp world, because it really did acknowledge the risk-reward factor that we're all dealing with right now, which is how can we do what we do well, given that we're doing them under extreme circumstances with limited resources. And so that actually, those resources and the decision-making tree that the CDC worked together with the American Camp Association to provide helps us determine what those decision-making factors are and how to best address them for our communities. Project Camp right now is also working on what I think has become a large topic as summer really hit. The expansion of COVID bubbles has really led families to look to maybe not send their kids to some sort of childcare opportunity, but to connect them to other kids. To take, instead of a bunch of bubbles and put them all into one big balloon, but to connect one bubble to another bubble on a block where there are some families that have started allowing their kids to be together out in front. They're still socially distanced. They're still wearing masks. I have seen one of the moms send kids in on a regular clip for hand washing, which I think is a fantastic move, and is strikes a camp chord to me. But we're seeing that structure start to come out from parents, really not in the sense of creating a program, but of creating a space and parameters in which our kids can be kids. And I think that's the thing that we really want to elevate as an organization, and that I think as community leaders here is an essential way that we can get back to the work that we want to be doing with our communities, is that we just need to set parameters on what we're doing and a set of cultural agreements, and within that we can operate. I think the COVID period didn't it created a bunch of new challenges. It also highlighted a ton of challenges that already existed. And so for us at Project Camp, what we try to do is not reinvent the wheel, but to take summer camp, push it through a coffee filter and try to get it to its absolute root to figure out what was working and how to make that work given this environment. And so knowing that creating a sense of agency and safe, supportive relationship and creating meaningful connection is essential to children, to community growth, to kids' growth and development. Being able to apply that to what LA County Public Health was able to do, and really distilling down what are the essential ways that we can stay as safe as possible and manage as much risk as possible. Combining those two things has really led us into what our actual solutions can be. And I think that's where, sitting from my position, I think that's where we've started to work with schools and integrating trauma-informed care into their programs as they prepare for the school year, to other Boys and Girls Clubs and to JCCs that are going back to bringing programming and space for that meaningful connection to come back, is to distill all of that down into what the root needs and desires and goals are, and how that can be applied here. And it's not to reinvent, but to actually, I think in many ways, shave away a lot of the complication and the nuance that we really go for, and to really get to a place where we're we actually want to be doing this, and so we're going to do this because this is what supports our kids the most. And that's really exciting. This is a really difficult time, and it's been difficult for a long time. And I think at Project Camp, I will say, speak for myself, being able to work with a team that was looking to pivot, that our natural inclination is to find a way to take disaster and make lemonade out of lemons. That's been a really positive space and sense of agency that I've gained from the work that we've been doing through the spring, and that really helps. It's the sense that I'd like to be sharing with more community organizations and more schools and more people who are doing work with youth and with communities in this time, because I think that's actually the pillar that we are all able to stand on most and connect and move through this process. Yeah, I'm happy to answer any questions afterwards with the rest of the group, but I just want to say thank you for being here, and thank you to the Red Cross for creating this space.
Awesome. Thank you so much, Mikey. What you said about having to pivot and find out, what's the root of what we're trying to do, I feel like we're all feeling, and that really resonated. And so all of the resources Mikey mentioned, including LA County Department of Public Health Day Camp protocols, are in the chat, as well as the Project Camp website, and they're awesome resources, and we will have time to answer his questions at the end. Thank you so much, Mikey.
Thank you.
All right, next we will have Dr. Debra Duardo, the Superintendent of Los Angeles County Schools, and we're very excited to have her. So take it away, Dr. Duardo.
Thank you, and thank you to the Red Cross for making this possible. It's an honor to be on with the other panelists, and thank you for all of the participants. This really is a time where we all need to come together. Not only during a worldwide health pandemic, but all of the racial injustice and pain and emotion that has caused in all of our communities. It really is a time where we need to all come together. So I'm happy to be here. I just wanted to start off by giving you a little information about what the LA County Office of Education does and what student population we're looking at throughout the county. So we have about 2 million school-age children in LA County, and that comes down to 80 school districts. Typically, people think about our largest district, which is LAUSD, but we have 79 other districts. In fact, most of the students living in LA County attend one of those smaller districts rather than the larger LAUSD. So about 2 million students that we're serving. In addition to that, we have about 362 charter schools, and the LA County Office of Education supports all 80 of those districts, supports them with their budgeting, with their professional development, with some of the compliance issues and laws that pertain to education, but really being there as a thought partner and support to help our districts and all of our schools as we're going through these difficult times. I also just want to say that, and it was pointed out by some of the other panelists, that, prior to this pandemic, we knew that we had some disparities in outcomes for our children. And so what this pandemic did was really put a real spotlight on the number of children that were disparately affected by this pandemic. And so just to give you a sense, even before COVID, we have about 67,000 students who were experiencing homelessness in LA County. We know that's probably an undercount because people don't tend to come up and self-disclose that they are experiencing homelessness. We had about 30,000 students in the foster care system, 180,000 students receiving services through special education, and 270,000 students are English language learners. 7 out of 10 of our students in LA County come from low-income families. So you can see there were already challenges that existed prior to COVID. We have incredible strengths in our families and our communities, but these were also some challenges that we were facing. And so on March 16th, as you all are probably very aware, we decided to close all of our schools due to the health crisis and ensuring that we were reducing the spread of COVID. And almost overnight, our educators had to go to a distance learning process. And that was very difficult. It meant training teachers, districts coming up with plans, ensuring that not only teachers had the devices that they needed in order to teach from home, but that also our students had the devices and the Wi-Fi connection that they needed in order to learn. And so that's where we saw so much of the disparities in terms of how this pandemic was affecting our students and our families differently. So many of our lower income families did not have the devices that they needed. They did not have access to the internet, or not strong access or strong connection in order to engage in instruction. We also found that many, or the majority of our low-income families, many of the parents were essential employees or didn't have the luxury of working from home. So they were still going out in the service industry, doing a lot of work that could not take place from home. And so students, oftentimes there was a challenge with who was going to take care of them, who was going to help them and support them through their learning as schools went to remote learning. Of course, this was very, very challenging on parents. As you can imagine, parents that had challenges with the English language or didn't have the understanding of how to use the technology, it created a lot of difficulties for our students. It was even worse for our students who were experiencing homelessness, our foster youth, our students with disabilities, our English language learners who are predominantly children of color, poor children of color. And so we as an organization immediately had to look to what can we do immediately to make sure that all of our students have the devices that we need. We raised millions of dollars. We worked at the federal and state level and with philanthropy to get devices out to families as quickly as we could. Of course, there were many challenges with that because even if you got the money, oftentimes these devices were on back order and we couldn't even get them right away. So certainly a lot of challenges, and what that led to was a higher loss of instruction. Very much a concern for us, as we know there's already an opportunity gap, or if you want to call it an achievement gap, between our poor children of color and others. We want to make sure that we are minimizing that loss of instruction. So we quickly came together to raise money to institute a summer learning program where we can offer summer learning supports to districts so that they can have summer programs where they're specifically targeting those children who were not able to engage and connect with their instruction. You know, besides the instruction, you know, one of the things that we've always known, and I think people realize very quickly, are that schools are the hub of the community for many of our children and families. And so we were addressing many of the basic needs that families were struggling with. Districts were giving out over 2 million, almost 3 million meals every week. And not only feeding students, but feeding family members as well. We've partnered with some of your organizations to ensure that we were getting food out to our families that needed it so desperately. We also wanted to make sure that we were addressing the emotional needs of our children and our families as they were going through these challenges, and figuring out how we can use all of our counselors to do wellness checks and really basically connect with families. It was almost as if instruction was secondary very early on. We wanted to make sure that our families were okay, that they had enough food, that they were safe. If they were struggling with some emotional issues, how we could connect them and support them to other agencies, or use our own counselors to help them with some of the struggles that they were facing. So one of the big things that we really believe in are partnerships and making sure that we're working together, that schools and nonprofits and faith-based organizations and county departments are all on the same page and making sure that we're making children our priority and that we have a comprehensive plan in place in order to do that. So for us, it was really important. One of the things that I can say is right now, or actually since schools first closed, we've already been thinking about reopening. And how are we going to reopen in a very safe way? Districts are really struggling because of the safety precautions, the health orders that tell us we have to implement the physical distancing and the masks and the sanitizing. What that means is in order to bring children back to school, we can only have a fraction of our students physically on campus or in school at any one time. So what we're trying to do is figure out on the days that students cannot be in school, and are receiving their instruction remotely, what other organizations can provide supervision or a space where children can do their remote learning, for example, in a park, in a library, at the YMCA, the Boys and Girls Club, a church, synagogue, anybody who has open space that we could figure out how we can work together so that students can learn what the days they're not in school and their parents can continue to work or go back to work. There are lots of concerns that we had also just around student safety. We became aware very early on that the number of child abuse reports decreased almost by half. And so we wanted to tell all of the adults in LA County, all of the agencies that are serving families to check in, to support families, to see if our children are okay, because we wanted to make sure that our children were safe. So in terms of working together, I think this is a critical time where we all need to figure out how can we work together. If you have a service that you can offer at or near a school or remotely, mentoring, coaching, counseling, food services, it's a time when schools and districts are really in need of support from other members of the community. So I'll stop there and be open for questions after. Thank you.
Thank you so much, Dr. Duardo. That was such incredible and really important information. And I completely agree. It's time for connection and utilizing each other's services and resources. Thank you so much. And the website to the Los Angeles County Department of Education is in the chat if anybody needs that. Really important resources there. And we will answer any questions in the chat at the end. Thank you so much again. And next, we will have Myra Valle of the American Red Cross Los Angeles, our very own. She is the director to the services of the Armed Forces and International Services program here at the Red Cross LA, and she'll be talking about one of our fantastic programs here that supports our families.
Hi, thank you so much for this opportunity to share 2 lines of service within the American Red Cross. I know that many of you are very familiar with our disaster program and our blood services. However, one of the oldest actually founding lines of service is service to the Armed Forces and International Services. So the American Red Cross actually has been supporting our U.S. military for over 135 years. We do that 24 hours a day, 7 days a week through our Hero Care Network. We're also the key to connecting those families due to an emergency. So we provide that emergency communicating message to our service members when they are deployed. We are the only mandated organization that's capable of doing this for all branches of service. So it's a very important line of service that we provide for service to the armed forces. With that, we've also have 11 different resiliency workshops. Those workshops are actually facilitated by our licensed clinicians that are volunteers that have dedicated their time to support our military and our loved ones as well. 2 of those modules that we do have and we do provide are for our child and youth. We did extensive research on coping with stress, just like many of you have already shared on this call, that our children and our youth cope with stress very differently from adults. And being able to communicate and discuss those stressors and also communicate with your children is very important and key. So we created 2 of those workshops to support the military children and our youth. One of the biggest challenges that we've had is we would normally have these types of workshops conducted in an in-person setting. However, with the changes that we've had to make with COVID-19, we are adjusting all those modules to provide those in a virtual platform. One of them that was immediately created within a month of COVID was the COVID-19 module, which helps identify those stresses that we currently have working from home. I do relate with Miss Nancy when you said, you know, being able to work from home, having children, having them connected to online classes has been very challenging for some of them, me included, with a child. But being able to discuss and have those conversations and be able to identify the stress and find ways to cope with those stresses is very important. And that's what our licensed clinicians do, facilitating these workshops. With that as well, we have navigated majority of our in-person events to online events, providing the resources that we offer. We do connect our military family members with either local or national resources through a system that the Red Cross has in case they are in need of any support. During COVID-19, what we did notice is that a lot of our service members and veterans had lost their jobs due to COVID and needing that financial support, and also seeking support for employment was very big. So we were able to connect those families with those resources that were needed. Along with supporting our military with resources, we are very connected to the community as well. You know, we work very closely with other organizations and other programs to support our military and work together and find ways where both of our services can align together to give those clients that we serve, you know, more information and more resources for them. So right now, like I mentioned, we are currently in the process of reestablishing our in-person workshops to all virtual platform workshops. That way we can provide all these services in a virtual platform, and more information will definitely come out through our website, redcross.org, and I'm sure our lovely ACT will be putting it on this side so you all can see. In addition to that, we will add also in the chat, there's 2 separate links with videos pertaining to service to the armed forces, giving you an extensive view of what we do from the enlistment of the service member to their veteran services, which we are really involved with the Veteran Affairs hospitals with our volunteers, which that's also created a challenging aspect for us because some of our volunteers are not able to go back and support. So we're currently working with the West LA VA to provide calls to our veterans from home. So it's actually something that we are processing right now at this moment, which I'm really excited for. So it gives our volunteers an opportunity to still be connected to our veterans, even though they're not in person. And I'll shift real quick with our international services. We provide a resource where we reconnect families that have been displaced, whether it's a disaster, war, or having to flee their country. We connect with all our international Crescent and Red Cross partnerships internationally to provide this service to our clients here. So one of the videos that ACT is going to add in our chat actually is a true story of one of our clients that we serve that was reconnected with some of their loved ones when they had to flee their country and come to the US. So you could see exactly all the type of work we do. In addition to that, we also have our youth action campaign that has started. It's very active with our high school children from ages 13 to 24. And our youth action campaign actually started last year, and this will be our 2nd year. What we do is we empower our youth to educate the community with on international humanitarian law. This is a great way for our youth to vocalize and impact the world. They're, as many of you know, our youth are very vocal, and they're ready to make changes and support for the better. And this is a way to educate our community and their peers. We found that it was very important that peer-to-peer will be able to communicate this type of information. So we've already shifted our education in a platform setting. A lot of our youth volunteers that participated last year are coming back this year. So they're very familiar with the information. We definitely invite high school students to participate if they're interested in forming a youth club at the school. They're more than welcome to participate in this youth action campaign. And they're led by our volunteer coordinators to guide them with the information that they will be providing to our community. With that said, if you're interested in volunteering, if you want more information on our youth action campaign, please don't hesitate to go onto our website, redcross.org. We appreciate the community. We appreciate the volunteers. Without volunteers, we wouldn't be who we are today. So I thank you so much for your time.
Thank you so much, Thank you so much, Myra. That was so helpful and such wonderful information on one of our incredible programs. Thank you so much for all you do for our community and for all that really great information. All the resources, like she said and pointed out so lovely, are in the chat right there. And as well, I forgot to mention at the top, we'll send a follow-up email with all this information. So if you don't catch it in the chat, don't worry. All right, so if you have any questions, feel free to put them in the chat or the Q&A. And there is one question specifically for Nancy that we'd like answered. Let's see. There. I might ask our communications deputy director to hop on and potentially help us out with that. Okay, here is the question. Okay, for Nancy, is there a task force that has different forms of foster families that just have educational communities of all families, including teachers, social workers? So is there a task force that you know of with faith and educators that is available in Los Angeles?
You know, yes, there is a couple of different collaboratives. There is the Foster Together Network, and the Foster Together, and I would have to get you that information. You could probably find that online somewhere, but the Foster Together Network is a network that includes faith-based as well as education components. We have a lot of input from the Pritzker Center that has a lot of information, working closely with UCLA, that has a lot of information on education. The Department of Children and Family Services in their faith-based collaborative also can have some education individuals as part of that network also too. Does that answer the question?
Yes, I think that's wonderful. And if any other panelists, have any intel as well, feel free to chime in. Thank you so much, Nancy.
You're welcome.
Okay, looking at the next questions. Let me. Okay, this one is for Dr. Duardo. And it's specifically asking, is there anything being done in the coming year to address conditions in low-income schools in the county?
Yeah, so we've been doing everything that we can through a lens of equity and really addressing the need based on, actually from financing schools, how schools are funded, to how teachers are hired, to creating more pathways of teachers of color to be able to better support children of color in all of our schools. So there has been a lot of work done to make sure that whenever we're thinking about how we can better support schools, that we start off by the students that need the services the most, which are predominantly our low-income schools, starting from looking at which teachers are placed at which schools and how to ensure that the students with the highest need are matched with the strongest, most qualified teachers, to, as I said, funding, different initiatives. We have a community school initiative that targeted our highest, are the number of districts that are the lowest income families, and bringing more resources to those sites.
Wonderful. Thank you so much, Dr. Duardo, for that wonderful answer. Another question for Dr. Duardo. Are there job or volunteer opportunities available for mentors, coaches, or college students that can support students' emotional needs? And if so, where could we find those?
So really, there isn't like a comprehensive plan of looking for volunteers. I know that the governor has a Volunteer California, and I've actually reached out to say, can we do something that's specifically a portion of that's just for schools? Because there isn't a plan in place that I'm aware of across the entire county. The way to reach out is to reach out to the district that's closest to you where you would like to offer, and districts are looking for volunteers that can offer services. Right now, because of the pandemic, for the most part, those services would have to be remotely, either mentoring, coaching, connecting with parents or students virtually.
That's excellent. Good to know. And then final one for Dr. Duardo. Do you expect schools to reopen next month? And which safety guidelines do you anticipate following when they reopen?
So that's a really good question. The situation is so fluid and is changing every day. We're going into this with a plan to reopen, next month. We want and know that our students need to come back to school, and that schools are the best place for our students to be. However, we need to make sure that we can reopen schools in a way that's safe, not only for our students, but for all of our employees as well. So we are waiting. We've seen a draft from the Department of Public Health in terms of what the health orders are going to be for reopening. We expect that students are going to be required to maintain physical distancing of 6 feet, that all students and all employees will be required to wear masks unless it's children under 2 or somebody has a medical condition that prevents them from keeping a mask on. We'll be required to disinfect and clean all of our schools and classrooms and surfaces that are touched. So, as I said earlier, that creates some challenges. So we will reopen. Does that mean that all children will come back 5 days a week? I don't think so. We physically wouldn't have enough classroom space or enough teachers to be able to maintain the small classroom sizes in order to, maintain that 6 feet of distancing. So there are going to be some challenges, but we're doing everything we can to reopen and to have different options for students and families.
Thank you so much for that, Dr. Duardo. And a question for Mikey. What do you miss most about summer camp? And is there any way for people to make summer camp memories at home?
Yeah, absolutely. My favorite thing about summer camp actually is the ability to create, what I can say is to make something profane into something sacred. So my favorite camp supplies are cardboard and duct tape. They're the most versatile. You can literally do anything you want with them because they're just a blank slate. So for example, I ran a program once where I had kids build boats that they actually sat in and paddled across a pool just out of cardboard and duct tape. Partially because it's a great resource. At the time I was working at a camp that had lots of cardboard on hand. but also to highlight that this stuff, like the stuff that we're talking about, the space that we're creating, the memories we're creating, they don't have anything to do with the stuff that we're using. They just have to do with the people that are there and the space that we decide to create. And so I think the thing this summer that when the conversation around what camps can kids go to, what can kids do, how can they do things, I think there is a space to start to talk about, like, what if we kind of let them figure that piece of it out. There's a lot like with kids that I think that they have a drive and a desire to entertain and to entertain themselves and others and to create space for themselves. And I think being able to foster that kind of a space and give resources and framing and say like, hey, this is what we can do with this. You're going to be in this backyard for the summer. These are all the goofy things that we could do with this backyard. I think that's the mentality and the space that I miss from camp, but that I see really coming out of what we're talking about right now in this space. And even what Dr. Duardo was just talking about and figuring out how to approach school next year and the creativity that's going to need to be part of our everyday thinking now.
I love that. My whole childhood revolved around summer camp. It was my favorite thing in the world. So I love making that possible, even under these circumstances. So thank you, Mikey. And I think that is all we have for today. As I said, all of the resources are in the chat, and I will email them shortly after this, later this week, to all attendees for anyone that needs anything. If you have lingering questions, you can email us. If you need anything, your community, you can email us at faithbasedla@redcross.org. The Red Cross has so many services, including the ones Myra mentioned, that we can set you up with so that you can support your families and your community. I want to say thank you really quickly to John Excel, our Regional Deputy Director of Communications at Red Cross LA, my supervisor, Jennifer Johnson, Director of Community and Faith-Based Programs at Red Cross LA. And thank you to our panelists, Nancy Harris, Mikey Latner, Dr. Debra Duardo, and Myra Valle, for your wonderful contributions and resources and doing all you can to support our communities and our families right now. Again, if you need anything, you can reach out to us. And thank you all for being here, and stay safe.
Thank you.